This podcast is brought to you by The Senior Techie, a source of information for seniors and others about technology. Welcome to the show, everyone. Imagine hiring a private, highly trained nurse to fight your insurance company, organize all your specialists, and even sit in on your medical appointments to ask the tough questions.
Right. And then, never having to actually write them a single check.
Exactly. Today on the Senior Techie podcast, we're looking at a service called Solace Health that does exactly that.
Yeah.
The most incredible part, and the detail that completely hooked me right away, is that this personal advocacy is often funded entirely by Medicare and Medicare Advantage plans.
Yeah, which, that turns the traditional model of healthcare advocacy completely upside down.
Yeah.
Historically, having a private patient advocate was this very boutique sort of white glove service.
Oh yeah, definitely out of reach for most people.
Right. It was something wealthy families paid thousands of dollars out of pocket for, just to ensure their parents received premium care. So bringing that level of professional medical navigation to the broader Medicare population, well, it really changes how older adults interact with the whole system.
And we really need to unpack what that interaction normally feels like because, we have all been in that exact scenario. You or maybe your aging parent are sitting in that tiny exam room, right?
Yeah.
The paper on the exam table is crinkling.
Oh, the absolute worst sound.
It really is. You've been waiting for 45 minutes, and then finally the doctor rushes in, delivers this flurry of updates, throws out terms that sound like a completely different language, scribbles something on a notepad, and then just rushes out to the next room.
Yeah, and you were left sitting there, clutching a piece of paper, completely overwhelmed.
Just wondering what on earth you're supposed to do next.
It's an intensely isolating experience because the stakes could not be higher, right? It is your health or the health of someone you love. Yet you're expected to process complex medical information in what, a 3-minute window?
Right, exactly. So our objective for this episode of the Senior Techie podcast is to examine how Solace Health actually attempts to bridge that massive communication gap. We need to look at the tangible benefits for seniors and their caregivers.
But we also need to scrutinize the flaws, because there are definitely flaws. Whenever a service scales up rapidly on the government's dime, well, structural red flags appear. And we want to ensure you know how to navigate this safely.
Yeah, I always compare navigating the modern healthcare system to being dropped into a foreign country where you don't speak the language, you don't know the local customs, and you definitely don't have a map.
That is a great way to put it. You're just wandering around hoping you don't step on a landmine.
Exactly. So hiring a Solace advocate, it sounds a lot like hiring a local fixer. You're bringing on a translator who knows all the shortcuts, speaks the local dialect of hospitals and insurance companies, and can guide you safely through those streets.
And that foreign country analogy is remarkably accurate because the healthcare system utilizes a dialect intentionally designed to be exclusive. Patients are suddenly confronted with, formularies.
Right, which are not just simple lists of drugs.
No, not at all. They are these complex financial tiers dictating exactly which specific pill your insurance will pay for. Or they encounter prior authorization.
Oh, the dreaded prior authorization.
Right, which is just that frustrating process where your doctor actually has to beg your insurance company for permission to perform a procedure they already decided you need. Or CPT codes, the secret numerical language hospitals use to bill insurance.
It's so confusing.
It really is. When you walk into a clinic, the power dynamic is inherently unbalanced. The doctor, the hospital administrators, the insurance adjusters, well, they hold all the cards and they understand all the codes, and you just have your symptoms and your stress.
So the goal here isn't to replace your doctor. It's to give you a medical voice and put you on equal footing. And the Senior Techie notes that this isn't just a fancy customer service hotline.
Right. It's not some automated phone tree where you have to press 4 to hear your lab result.
Thank goodness. No, Solace connects you with a real human being inside the medical system. Usually this is a registered nurse or a highly experienced healthcare professional.
And that human element, combined with their internal structure, is the real differentiator here. These advocates don't just operate in a vacuum. They are actually paired with a physician for clinical support.
Like really, a doctor's backing them up.
Yeah, exactly. If an advocate is dealing with a highly complex specialist referral, or maybe fighting an insurance dispute that requires actual clinical weight, they aren't just arguing administrative policy. They have a doctor backing their requests.
Wow, that has to change the entire conversation. If I call my insurance company and say, my mom really needs this MRI, the adjuster is basically just hearing an emotional plea from a frustrated son.
Right, they hear it all the time.
But if an experienced nurse calls up, backed by a physician, and says under Clinical Guideline 4B, this patient presents with these specific symptoms requiring this imaging, well, the insurance company is suddenly dealing with a peer, not a patient.
Precisely. It forces the insurance company to operate on clinical terms rather than bureaucratic ones. Translating that doctor speak into plain English is incredibly valuable. But getting an insurance claim approved doesn't automatically mean the senior actually gets a ride to the clinic, right?
Right. Or getting a caregiver scheduled for their home. That requires a totally different set of logistics.
Exactly. Solace advocates step into the day-to-day administrative nightmare of modern medicine. They coordinate appointments across multiple specialists, so if a patient is seeing a cardiologist, an endocrinologist, and a physical therapist.
The advocate actually ensures those 3 offices are sharing records.
Yes, which, let's be honest, they almost never do on their own.
Never. I think we all just assume our doctors are talking to each other behind the scenes, but the reality is they are totally siloed. If you don't manually carry your test results from one office to another, the new doctor is often just flying blind.
Yeah, so the advocate acts as that central hub. They also research in-home care options, ensuring advanced directives are documented, and perhaps most crucially, they can join medical appointments remotely.
That is huge. Having a professional ear on the line to ask the follow-up questions that a patient might just forget in the heat of the moment is so invaluable.
It really is.
And the senior techie shares some fantastic social proof regarding these day-to-day logistics. There's this Trustpilot review that caught my eye, where a user mentioned that making doctor appointments and scheduling round-trip transportation is now a snap with Solace.
Which is great, because we often forget how much of a barrier simple transportation is to getting good health care.
Absolutely. And it goes beyond just scheduling rides. Take the story of Diane J. Her cardiologist abruptly stopped taking her insurance. She was simply told to find a replacement on her own.
Oh, wow. The panic of losing a critical heart doctor overnight is immense.
It's terrifying. But her Solace advocate stepped in, researched the network, found a new specialist, and then seamlessly transferred all her records.
That's amazing. And beyond the logistics, the clinical impact can be completely life-altering. The senior techie highlights a deeply compelling case study involving a 72-year-old woman named Joan.
Oh yeah, I read about Joan.
Yeah, Joan had lived with undiagnosed, debilitating chronic pain for over 10 years. I mean, a decade of her life was fundamentally diminished by pain that multiple doctors had essentially shrugged off as just getting older.
10 years is a staggering amount of time to be dismissed by the very people supposed to be helping you.
It really speaks to how easily older patients are marginalized in such a rushed system. So Joan Solace advocate sat down and meticulously reviewed her entire decade of medical records.
Because they actually had the time to do it.
Exactly. By taking the time to look at the whole picture, something a busy specialist rarely has the luxury to do, the advocate realized a glaring omission. No one had ever fully investigated Joan's spine.
Unbelievable.
Yeah. So the advocate pushed for the specific imaging required. And within weeks, Joan received a confirmed diagnosis of spinal stenosis, which is a narrowing of the spaces within your spine that puts pressure on the nerves.
And once they had an actual diagnosis in hand, they developed a non-surgical treatment plan. And Joan was sleeping through the night for the first time in years.
It's a life-changing intervention, simply because someone finally looked at the map instead of just driving blindly.
But, let's look at another statistic from the senior techie, because I have to admit, it made me raise an eyebrow. They report that Solace advocates have a 54% success rate in overturning denied insurance claims.
Yeah, that's a huge number.
It is. I understand having clinical backing, but insurance companies are notorious for being absolute brick walls. How does a third party systematically overturn more than half of the denials that the actual patients couldn't even budge?
Well, it really comes down to understanding the mechanics of an insurance denial. Insurance rejections are very rarely about a human being deciding a treatment isn't medically necessary.
Right, it's not personal.
No, they are almost entirely about algorithmic, bureaucratic formatting. When a standard patient appeals a denial, they write a heartfelt letter. They argue from emotion and common sense, saying, I am in terrible pain. My doctor said I need this surgery. Please approve it.
Which makes perfect sense to any rational human being reading it.
Exactly. The problem is, a rational human being isn't making the initial decision. An algorithm is just scanning for codes. The advocate, on the other hand, knows the specific bureaucratic language required.
So they know how to talk to the machine.
Right. They might review the original denied claim and realize the doctor's billing department just forgot a specific clinical modifier code, like a -25 or -59.
Ah, what does that code do?
It basically tells the insurance computer, hey, this wasn't just a routine checkup. It was a complex secondary evaluation that warrants this specific test. The advocate knows the exact phrasing the insurance adjuster needs to see to check their internal compliance box and just approve the appeal.
Wow. So they aren't trying to change the insurance company's mind. They are just formatting the request so the machine accepts it. That makes perfect sense.
Yeah, and the ripple effects of this kind of intervention extend far beyond just the senior receiving care. We really have to look at the caregiver dynamic, especially adult children who are trying to manage all of this.
Absolutely. Caregiver burnout is an escalating public health crisis on its own. The burden of care coordination typically falls on adult children, a burden in the healthcare system. The healthcare system simply expects families to absorb without any training or support.
Picture the classic scenario. You live in New York, and your aging mother lives in Florida. She has a sudden health scare. You fly down, stay for a week, get her stabilized, and then you have to fly back to your job, your kids, and your own life.
And suddenly, your entire lunch break every day is spent playing phone tag with Florida medical offices in a different time zone.
Right. You're trying to figure out what home care agencies are reputable in a town you don't even live in. The guilt and the exhaustion are completely overwhelming.
But having a professional advocate who is locally networked fundamentally changes that dynamic. The advocate becomes the project manager.
Exactly. They handle the phone tag, they vet the home care agencies, and they ensure the Florida doctors are actually sending the prescriptions to the right pharmacy.
It removes the immense logistical weight from the family's shoulders, allowing that adult child to simply be a supportive son or daughter again, rather than a frantic, long-distance medical coordinator.
Yeah, which is priceless.
It really sounds like an absolute dream scenario. I mean, overturning denials, diagnosing decade-old pain, relieving caregiver burnout, all while Medicare foots the bill.
Right. But as we know, no system is a utopia. We promise to look at the entire picture, including the flaws.
Yes, and when a private service is tapping into federal Medicare funds, there's always a catch. What happens when this system falls short?
We really need to examine the structural red flags very carefully. The senior techie points out a really strong point here. While the overall pattern of reviews for Solace's 14,000-plus patients is strongly positive, there are some deeply concerning reports surfacing on platforms like Reddit.
Yeah, the most alarming of these involves billing transparency and the exploitation of Medicare's fee-for-service model. There was one specific report that absolutely floored me.
The $4,000 one.
Yes. A Reddit user discovered that Medicare had been billed $4,600 for a Solace advocate doing almost nothing. Essentially, they just obtained one set of medical records.
It's wild.
$4,600 for basic paperwork. How does a single PDF of a patient's history generate a bill that large without someone going to jail?
Well, it highlights a massive vulnerability in how Medicare billing functions. In a fee-for-service system, providers bill based on individual actions and time spent.
So they just stack the charges.
Exactly. Unscrupulous or overly aggressive billing departments can exploit this by stacking administrative codes. They might bill for an initial comprehensive assessment, then add codes for care coordination planning minutes, followed by complex record review analysis.
So if an advocate spends 3 hours tracking down a difficult set of records, the company bills Medicare for every single 15-minute increment under the highest possible complexity code.
Right, and that invoice balloons exponentially. The patient never sees the bill because Medicare pays it, but it drains federal resources and understandably leaves the patient with a bad taste in their mouth regarding the advocate's true priorities.
That makes those quarterly Medicare summary notices, the papers you get in the mail that say this is not a bill, incredibly important to actually read. You need to see what is being charged in your name.
You really do. And the complaints weren't just about the money either. There were reports of advocates showing up completely unprepared for appointments, or advocates who wouldn't return phone calls.
Or those jarring mid-process reassignments where a patient is suddenly handed off to a brand new advocate right in the middle of a complex medical crisis. That sounds awful.
Yeah, the discontinuity of care is a major issue. The senior techie actually features a review from a former nurse who briefly worked for Solace, providing a look behind the curtain.
And what did they say?
This nurse stated that the company felt severely understaffed and was expanding faster than its internal support structure could handle.
It's the danger of a company prioritizing rapid expansion and user acquisition over the actual quality of care. When a service grows too quickly, the patients become the ones who fall through the cracks.
Precisely. But synthesizing these reviews reveals a very clear, defining pattern. Look at the positive experiences we discussed earlier. The Trustpilot user, Diane J., Bobby Joe M., or the reviewer who warmly described their advocate, Janelle, as feeling like an old friend.
Oh, I see where you're going. Every single one of those glowing reviews names a specific individual.
Exactly. The success stories are always tied to Janelle or Joy, while the negative reviews are always complaining about the company or the system.
So the ultimate takeaway here is that your experience with a patient advocacy service lives or dies based entirely on the specific human being you are matched with.
Yeah. The logo on the website matters far less than the dedication and competence of the nurse assigned to your case.
Since the human element is the whole ball game here, we essentially have to treat that first interaction like we're hiring an employee, don't we? I mean, we are the boss. Even though Medicare is writing the check, they are working for us.
That is the exact mindset required. The senior techie advises treating your very first conversation with a new advocate strictly as a job interview.
Okay, so what are the primary things we should be listening for in that interview? I'd imagine we want to clarify their actual medical credentials right away.
First and foremost, yes, ask about their clinical background. You want someone who has spent time in the trenches, like a registered nurse or a licensed clinical social worker.
So you do not want a purely administrative assistant who only knows how to operate a calendar and a phone system.
Right. They need to be able to read a lab report and understand what it actually means. Second, test their communication reliability immediately.
Like by sending them a message and seeing how long it takes to hear back.
Precisely. In that first week, ask a simple, non-urgent question. If it takes them 3 days to respond to a basic inquiry, consider that a massive red flag.
Because if they're unreachable for minor issues, they will definitely be unreachable when your pharmacy suddenly refuses to fill a critical heart medication on a Friday afternoon.
Exactly. And you also mentioned the issue of mid-process reassignments earlier. We should probably ask them point blank how they handle transitions.
Like asking, what happens to my case if you go on vacation or if you leave the company? Who gets my file and how are they briefed?
Yeah, establishing those expectations early prevents panic later. Most importantly, the senior techie makes a really strong point here about a crucial right every patient has.
Which is?
If the vibe feels wrong, if they seem disorganized, or if they just aren't listening to your concerns, ask the company for a rematch. Do not settle for a bad fit just because you want to be polite.
We do have a tendency to not want to make a fuss. We don't want to be the difficult patient. But when it comes to navigating the medical system, being a little difficult is sometimes the only way to survive.
It really is. Your health is way too important to leave in the hands of an advocate you don't trust.
Looking at everything we've covered, I'd imagine if someone's health is relatively stable and they just see their primary care doctor once a year for a physical, this entire setup is probably overkill.
Yeah, if your health is stable, your doctors communicate beautifully, and your insurance approves everything without a fight, do not add another layer of bureaucracy to your life.
Just keep the knowledge of this service in your back pocket because health situations can change 24/7, but you don't need it today.
Exactly. But for the folks who are managing 3 or more daily medications, bouncing between different specialists who never share notes, or leaning heavily on a daughter who lives 3 time zones away,
This sounds like a necessary lifeline.
those are the crime candidates. Anyone dealing with a confusing new diagnosis who feels paralyzed about what the next step should be, or anyone who has simply run out of energy fighting denied insurance claims.
And Solace is BBB accredited. They operate in all 50 states. And the initial intake session at solace.health is free, making it accessible to evaluate without immediate financial risk.
It provides immense peace of mind just knowing a mechanism like this exists, even if you don't need it today. It's a highly practical solution to a deeply exhausting problem.
It really is.
So, as we conclude our analysis today, I want to pose a question for everyone listening to reflect on, whether you are managing your own care or maybe helping an aging parent.
Okay, let's hear it.
Think about your current medical to-do list. What is the one healthcare task you have been actively putting off simply because it feels entirely too complicated to figure out alone?
Is it finally disputing that ridiculous lab bill from 6 months ago?
Mm-hmm.
Or finding a new neurologist because you just aren't happy with your current one?
Exactly. Identify that specific, overwhelming task. Then consider if that is the exact burden a professional advocate could take off your plate tomorrow, allowing you to focus on your actual health instead of your healthcare administration.
What a brilliant way to reframe the problem. Stop staring at the complicated map and just hire the local guide. This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to receive their free newsletters, you can subscribe by going to subscribe.theseniortechie.com.